Hey everybody, welcome. We are the FitHealth Pros. This is our pain series. Today we're going to be talking about ankle pain. So when I first started doing research on this, I thought it was going to be a nice, neat, short video. And then I found out that there's a lot of different ways that you can have ankle pain and different, so we're going to have part two. This is part one. We are the FitHealth Pros. I am Coach Sean.
I'm Dr. Kevin.
And welcome to this journey, this FitHealth Pros journey. Today we're going to be talking about ankle structure, swollen ankles and their causes and some possible remedies for those. And then we're going to jump into some common causes of ankle pain. Because there's so much, why don't we just jump right into it?
All right, here we go. So the first thing we want to do is let's talk about the ankle structure itself. So the ankle is a complex hinge joint with three different joints. So here we go. I'm going to hopefully not stumble over the verbiage.
Big words.
I'm going to read it too. The talocrural, the inferior tibiofibular, and the subtalar. So that's what's going to move the ankle joint side to side.
That's what makes it a complex hinge. Instead of straight up and down, it also has a side to side too with the subtalar.
Correct. So within the ankle bones themselves, it's made up of synovial joints. So they're going to be special layers of cells. They line the joint capsule and they produce synovial fluid found between the bones, and it moves against each other. So that keeps it from bone on bone, and you get a glide there. So there's four motions within the ankle joint. You have dorsiflexion, thank you, plantar flexion, nice, inversion, and eversion. Awesome.
Like that, sound
Yeah.
effects too. No extra cost.
Now, there's numerous ligaments due to attachment of the bones of the leg to the bones of the foot. So you have many ligaments, tendons, and muscles in there as well. Now, the ankle bears the force of 1.5 times the body weight when you're walking and 3 to 4 times running and jumping. So it can handle, it's meant to handle a lot, but there's if you have any little issue, obviously that can be a weak area.
Yeah, with that kind of force, there's no question why we're going to be having so many of these ankle issues popping up within these two videos.
Yep. All right.
Well, the first issue,
What's the first issue?
swollen ankles.
Okay.
So many people out there, I'm sure, have dealt with swollen ankles. As we start to age, it becomes a really big deal that causes a discomfort due to this swelling. It can last a short while, or it can be more chronic. It can be an issue that never really goes away. Some of the causes could be trauma from injuries, that swelling that comes immediately before the pain, or with the pain, I should say. Blood vessel blockage, lymphatic blockage, possible skin infections, and or arthritis. In terms of remedies for these, it's so uncomfortable for so many people. The number one remedy that I've come across through many different studies and many different articles is walking. You know, get that blood flow going and just walk. You know, get that movement going. That range of motion is going to help. Another possible remedy is hydration, sleeping on your side. Hydro exercise, which is interesting because that takes some of the gravity out of the effect. If it's too painful to get that walking in that I was talking about, that hydro exercise can take some of the weight off through the buoyancy of the water. Another possible remedy is limiting sodium so it doesn't blow up from having too much salt in your diet. Compression socks. We were talking earlier about a possible business where you get some compression socks that look a little more trendy.
Right, high-end compression socks that everybody is flaunting, the new fashion of the day.
Flaunting my compression socks. You know, don't be self-conscious about having to wear them if it's going to help you, if it's going to make you feel better. It doesn't necessarily make you look older, it makes you feel healthier. Let's go that route.
Yeah.
And last but not least, elevate your feet. You know, again, dealing with blood flow issues and taking some of that swelling away.
Right. go into common injuries next. But I think that the swollen ankles and just understanding, because that's probably going to be more popular with people, a more common occurrence.
Sure.
So if that helped you, definitely smash that like button. And that's what we want to do, is give you more. So here we go. We're going to do some common injuries. The sprained ankle. So everybody has probably rolled their ankle at one point and felt like, oh my
It's
gosh.
the end of the world. My foot's going to fall off.
Yeah.
This hurts so bad.
Right. And especially if you're a 10-year-old flag football player, I've seen them or even better is the professional soccer player.
Yeah.
Oh my gosh, those sprained ankles look like they just
They
like
were shot.
their foot fell off. and I don't know how they do it, but really.
But they come back.
They come back real
pretty quick, yeah.
But a sprained ankle, there's a tear in the ligament. It's commonly a sideways roll. You roll the ankle. There's going to be bruising and swelling there. The treatment is going to be the RICE treatment. So that's the rest, ice, compression, and elevation. If it's light, usually a few days, you should be pretty good.
Yeah, it doesn't take you long.
Yeah, and unless you're a professional soccer player.
Why are you bagging on professional soccer players,
I don't
man?
know. They're better than rugby players. They don't do that, right?
Yeah, we don't.
No.
No.
That's the thing. Let's see. More serious type of a sprain is going to be, you're going to have to do some PT, possibly a short cast, or even a walking boot.
Sure.
Okay.
Or a combination thereof, yeah.
Right. And a high sprain, that's going to be your most serious sprained ankle. There's going to be a force on the leg above the ankle, and the foot is still planted. So you can just imagine what that looks like, maybe reviewing some football replays. And that high ankle sprain, definitely more serious.
Yeah, it takes you a matter of weeks to come back from that instead of days.
Okay.
Hurts.
Now, there's another injury or a symptomatic thing that you feel that's going to be rheumatoid arthritis. So rheumatoid arthritis is an immune response. So it's in the arthritis family, but it has to do with either an autoimmune disease where the body is causing inflammation. That's going to affect both sides of the ankles. It's going to cause pain, swelling, stiffness. Because of all the inflammation, you're going to get a lot of stiffness in there. It progresses from the toes to the front of the foot and then even into the ankle. All right. What do you want to do for that? Well, exercise has been shown to improve the symptomology there. You may have to get physical therapy. There are special shoes. A lot of people wear an orthotic or an insert. Maybe taking pain medications to decrease that. There are special rheumatoid, where that autoimmune, there are special medications just for that. So see your specialist on that. And then if you're taking any anti-inflammatories, make sure you're telling your primary care doctor. And again, you want to see a specialist for this. Now, osteoarthritis is another one. And osteoarthritis is a little different than the rheumatoid, where it's still the swelling in the joint, but it's going to be that bony segment. So you're going to have an increase, maybe a calcium deposit, a wear and tear. You're going to feel that it's a wearing down of the cartilage. So again, the symptomology, you have pain, stiffness. With osteoarthritis, you're going to have loss of mobility there too. So you may have so much calcium deposit or bone spurs that the range of motion is severely decreased, that those bone spurs are banging into the top of the joint. You may be able to be successful with anti-inflammatories. And braces are going to help so you don't put so much pressure on the area. PT is going to help move that. But if it's bad enough, either steroid shots are going to be close to the last resort, and then surgery is the last resort. Okay. Ankle fractures, that's definitely an injury you do not want. We talked about how much force the ankle actually can take. So there's three bones. You have the tibia, the fibula, and then the talus, which again is made up of
about 7 different bones. Basically the back of the foot.
the whole, yeah, so you got your calcaneus, the heel bone, and then the other bones that are kind of surrounding that. Now, if you crack or break those, usually due to a trauma, you're going to have pain, you're going to have bruising, swelling, it's going to feel hard to walk. You may not know that it's broken for a while.
It's true. It's true. I was telling Dr. Fox earlier, I had a client who jumped out of a plane, do a little parachute, coming out of a plane, landed, broke his ankle, walked on it for about 3 to 5 days after because he thought it was just a sprain. It's pain is pain when you're dealing with that. And then when he finally went in, the doctor looked at him like he was crazy, and he's like, you broke it pretty good. Wow.
So before you see the doctor right away, you're going to ice that. You're going to rest, ice, compression, and elevation. Almost said it again. And then you want to see the doctor. Definitely get an x-ray, get an MRI, see what happened there. They may have you in a splint, in a cast. You may need surgery. And then there's the most severe type of ankle fractures, the compound fracture. You'll know that by looking down
and seeing the bone.
Yes.
Yeah.
So
we don't want that.
If you see part of the bone sticking out, definitely go to the ER right away.
Get some help.
Yeah. So that's starting with those common injuries. We have some more.
We do have more. More common injuries of the ankle in this pain series, Ankle Pain Part 1. Next common injury we're going to talk about is Achilles Tendonitis. So we're going to hit a couple of these Achilles type of injuries. Now this is Achilles Tendonitis is a heavy sudden strain in the Achilles tendon. Now this is that tendon that goes from your calf into your heel. So in Achilles tendonitis, there's going to be some tiny tears happening. There's going to be swelling. It's going to be tender to the touch, oftentimes warm. Generally, you're going to feel this most commonly, say, early in the morning or directly after exercise. They may prescribe some anti-inflammatories for it. You can do some stretching exercises, some heel lifts, physical therapy. Now, as these tears heal, if they heal nicely and go right back into regular use, no big deal. But if they heal with a tremendous amount of scar tissue over time, you may need some surgery to help with that. Next up, the next Achilles trauma, Achilles Tendinosis. This is more of a tissue breakdown due to overuse. Now this starts slowly, gets worse over time. So if you're having issues, please go see a specialist before it gets really bad. Now this will give you pain with a possible bump in the Achilles. So if you have some pain in your Achilles, you're doing some self-massage and you feel a bump, again, go see a specialist. Now sometimes this bump can be in the middle of the tendon, other times up and down, but it's pretty common in the middle of the tendon. They're going to have you rest. Over-the-counter drugs can help with this. Special shoes and or inserts are possibilities. Bracing could help, and also, again, possible physical therapy depending on how long you let it go. Next up, infections, bacterial infections mostly. Can make the ankle swollen, red, and warm. You can be sick and feverish, possibly, depending on how bad the infection is. If there's fluid in the ankle, a doctor may actually go in and remove the fluid with a needle and test it. Mm-hmm. Delicious, wonderful, awesome, not. May give you, after he tests it, give you antibiotics specific to the bacterial infection. Now, in more rare cases, it could be viral, it could be fungal, but generally this will be more of a bacterial infection. Last of these ankle issues in part 1 is going to be bursitis. Now, there are two bursae, main bursae in the ankle joint. Now, these bursae cushion the space between the tendons and the bones. You'll have inflammation. It can commonly be triggered by arthritis, overuse, improper footwear, or utilizing footwear that puts it in traumatic situation like high heels, over time, not the best footwear to possibly use. It's great for fashion, not great for overall foot and ankle health. If you are doing new workouts or you're coming back into workouts, that could also cause some bursitis as well. They have a progressive, anytime you're coming back into exercise or you're starting a new program, start a little more lightly until your body gets used to what you're starting. That bursitis that could come from that, it would be very painful and of course completely derail your workout program that you're looking to start. Now you'll feel a stiffness. It could be tender to the touch, it could be warm, there could be swelling. A specialist may prescribe some anti-inflammatories for you. Again, you can utilize some stretching or some light range of motion exercises just to try to increase the blood flow, promote some healing, possibly some ice or some heat, just again to promote some healing.
Awesome. All right, so there was a lot of information. That's why we split these videos up into 2 parts. So if you gained some information that's going to help you or a family member or even help you learn something so you can prevent that from happening, go ahead and smash that like button again. Please subscribe if you're not a subscriber yet. And
follow our journey.
Yeah, follow this. And we're going to put part 2. It should be already up, so we'll roll along with that. Now part 2, we're going to go into some more injuries and talk about some specialists that you may see if you have an ankle issue. And then we'll give you some prevention information as well. So we are the FitHealth Pros.
It's true. We are.
I'm Dr. Kevin.
I'm Coach Sean.
And thank you so much for joining us.
Yes, thanks for coming along for the ride. Join us for more.
All right. You're going to rest, ice, compression.
I like that.
You're going to do the rice.
That.
Yes.
You're going to do the rice.
Rice. Eat some rice.